It's about working both with clinician groups and working with patients and family groups. So it's partly about raising clinicians' awareness but also skills to involve patients in decision making. And then it's also about, in quotes, activating patients and families to want to and to feel able to come into the decision. So with clinicians, we can do training programs and we can raise awareness in the teams and skill development, communication skill development, and work out how to implement shared decision making in their teams, in their clinical pathways. So there's a set of work that can be done there. And then there's also, there are interventions that can be done to encourage patients to participate. And for example, things like the Ask 3 Questions campaign, encouraging patients to be aware of and wanting to ask 3 maybe simple questions. You know, what are my options? What are the benefits and harms of those options? What are the likelihood that they're going to happen? And encouraging them to want to ask those questions, feel able to ask the questions. So we can do that sort of work with both sets of stakeholders in the decisions. And maybe as a support to that, what we can also look at are what's called decision aids, which are to some extent the tools that may provide the information and encourage patients to reflect on their values, their preferences, their opinions, what's important to them, and to deliberate about that decision. So there are decision aid interventions. They can be very brief, they can be a one piece of paper summary of the topic, or it might be a booklet or a video or a website to view. So there are various formats that can be provided to support that decision making with a bit more background information. So sometimes that's suitable to a given treatment choice. Sometimes it's actually still very difficult because the particular circumstances of the individual patient will, in a sense, override anything that's presented from the quote average unquote patient. So it actually still comes back to the interaction between the clinician and the patient and supporting that shared decision making process. So I think there are things that can be done, and there's actually still quite a lot more to be done.